like to thank Ambarish and Purnima for allowing me to be part of the IC. I think it's relevant because we do get asked a fair amount of questions, um, especially about being as a part of the team. We do have, as far as I know, at least two groups working in Chennai, and then of course multiple models across the whole of India. I know there are successful models here in Indore, as well in some models in Gujarat. I think what is important is in terms of understanding. When you're looking at a laser refractive surgery, it is probably challenging no matter when or how you plan to do it, partly because of the HR challenges, and second is the finance. The fact is you're essentially selling a luxury, a lifestyle product which makes it unique compared to other ophthalmic procedures, especially something like when you compare it to a cataract where there is a requirement, and hence it requires fairly unique management strategies. As a group, or even if you're planning to put it individually, you think yourself as a small business owner who just happens to be a physician, and this is important to actually make it work. A solo clinician, if you're planning it that way, must also be a mini expert in marketing, practice management, and human resources. And that is something you would probably never learn in your 10, 12, 16 years of practicing ophthalmology. And this is specific to, in terms of setting up the practice. There are two models, as far as I'm aware, which work fairly well, and these are fairly time tested. It is not something that I've invented. One is a common surgical center. This is probably the most common, where there's an investment by an investor, doctor, or doctors, so they own it as a group. There's a fixed surgical fee for the OTUs, wherein you pay per procedure. It could be for LASIK, cataract, or any other OTUs that you want to do. Of course, the advantage is you have an option of investing in the best technology. Now, what is important, and that's something that is a deal breaker or a maker, is most people don't have OPDs there. None of the doctors would actually see patients. Now, a second way of looking at it is a group practice where you see all your patients together. Now, that requires a different level of understanding compared to a common surgical center, which tends to be more impersonal. But the advantage is you have, in the common surgical center, you have a larger pool of doctors who can use it, hence the usage tends to be a lot more. Group practice, which is in traditional sense the US type of group practice, requires more planning, and these have generally more successful models for super specialty, like a retina or very specific super specialty that you're looking at. Now, this is something that we realize, that avoid taking the step too soon in your career. Work in a similar operation setup, learn about the best practices so that you can use that knowledge for your own venture. A couple of years to observe a successful laser center is excellent training. It gives you adequate time to save money. And remember, you'll need a considerable amount when you have your own center. The second part is in terms of the equipment. Buying or leasing an excimer can probably approach about 5 CR is what an conservative estimate would be. This is excluding the interiors. Now, leasing and per procedure fees can sometimes be prohibitive. That means the company tends to make money out of each procedure that you use. Now, it's a good idea, if you can afford it, to have the laser outright. That tends to work. Now, there are some important factors when you're comparing a solo with a group. I think in terms of money, definitely the group that you would probably take home, a group would be less than if you have it as a solo owner. Now, efficiency of decision making is important sometimes for critical things, like suppose you need to replace the gas, you need to have a CMC, you need to change HR, you need to arrange for the sudden changes in the infrastructure, then efficiency of decision making, definitely solo is a lot more better compared to group. Group, you need to take consensus definitely beyond a certain level of expenditure. Risk, group definitely is less. But you have an advantage of super specialty access definitely in the group. That is, you have people with varied, we have retinal surgeons sometimes doing LASIK, so you have access to a super specialist who's willing to be part of the group. Patient access in terms of expanding your area of your source of patients tends to be more if you have a larger number of people who are doing it. time, absolutely no brainer. If you're solo, you tend to definitely have less time because you're wearing multiple hats. Now, access to technology is also directly related to the money that you put, but if you have more money, you tend to have more access to technology. Now, there is some groundwork for the practice before you put it. Business plan, Purnima did touch about it. I think this is important, but make it specific. Don't make it general. Make it specific. Discuss with partners, and this is important when you're planning for a loan because then it indicates a bit of cash flow. Location, definitely access to public transport, visibility, two important factors. Market size, and a very good estimate of market size is to look at supermarkets, because supermarkets would never put unless they have done the market survey. So Nilgiris or More Supermarket or Reliance Fresh are my indicators, and you will find that they would never put it within a certain population group. Usually what is their estimate is number of people that would use it on a regular basis. They call it repeat business. So they usually encourage roughly about 50 to 1 lakh for each supermarket. So that is a good market even in terms of when you're looking at setting up a practice. And more specifically, if you're looking at refractive practice, you need to probably target in the group which is between 18 to about 30. But now with the present affordability, we find there are a significant number of patients beyond 40 as well who want to explore LASIK because they've been wearing glasses for about 30, 40 years. Insurance is important. Remember that there are now some insurances that do give reimbursement for LASIK as well. Most of them have cutoffs even -3. These are mostly private insurances. As far as I know, the public related insurance don't give. But if you want to go down that route, remember you would then suffer from having to get delayed reimbursements, and you would have to perform the procedure, pay the company, and then wait for the money. So may not be an ideal financial model, but remember that a lot of patients, especially if you practice in areas where there is IT penetrance, they would be quite keen on covering the surgery under insurance. There are some finance models as well. This is important, especially if you're trying to fund it. Always, I'll touch upon it further, and there is, of course, a more detailed talk on that. There are some additional pearls for group practice. Have a clear monetary policy. It can make or break that policy. And more importantly, resolve monetary issues early, because invariably there would, those would be the sticking points for any refractive surgery center. Physician leader is important because then your decisions are also balanced with clinical outcomes. Get the right partners, easier said than done. I'm sure if you really want to know whether you're easy to work with, you should ask your better half or spouse, and she will tell you exactly what are your faults. Then you will probably try and correct them when you try and get the right partner. Remember that all partners need to have a bit of the finances, because sometimes decisions are made based on balance sheets, not emotions, and that is important. And of course, importantly, all need to contribute to build the patient volume. Sometimes you have what we call in corporate terms underperformers and overperformers. So I think that is important. Write down the common goal, have a strong administrator, and empower them. This is the other part in terms of having a clear plan for the use of the profit, especially if you're going to reinvest in technology. And usually 3 to 6 months of liquidity is critical. The other points is, in this present environment, advertising is not an option, it's a necessity. As a new center with financial commitments, remember to budget for that, because if you don't budget for it, sometimes it becomes difficult. Remember, most general ophthalmologists in the present setup don't refer LASIK patients to you for LASIK. They would mostly perform it themselves, especially when you're getting less cataract reimbursement. Also important, this is of course for any practice, have a standard workflow, documentation, monitoring, communication, and resource utilization, all business terms, but very important when you put them specifically to ophthalmology. Just a couple of last slides in terms of missed points with respect to HR. HR is important because this is probably one of the most important steps in building a group practice is staffing. It is almost crucial to have a good front desk person, because that is almost the most important point of contact and communication. Ideally, get the staff to multitask, maybe give them a bit extra for that. Remember, staff need to have a practice building personality. It is a term that I use quite often, that they need to be energetic, they need to be friendly, and they need to be able to show genuine concern. The other thing is, of course, financial viability. We find budgeting can be an issue, and have realistic numbers when you're projecting. Most people take the best numbers and then try and project it. Take an average, or preferably take the lean months so you have conservative estimates. Combination of deferred payments and longer EMI, and when you're negotiating as a group, you can get reasonable interest rate discounts. In conclusion, the group practice has advantages with respect to financial risk. Always do a market survey, check penetration, price the procedure right, because you may need to look at the market at that procedure and monitor the progress. Thank you so much.
Thank you so much, Dr. Anand, for that comprehensive talk. It was really